Welcome to your sixth set of notes in the Unit 8, which covers clinical psychology. Today we'll be discussing somatic symptom disorder. So first, let's talk about the word somatic. Root word here is soma, and we talked back in the biological basis unit about, soma cells, the soma of a cell, which was, the body of the cell. And then we also discussed the soma sensory cortex in your brain, which is controls all the senses of your body. So soma means of the body. So it's characterized by physical symptoms that seem to suggest a physical disorder, yet have no physical causes or evidence suggests that the symptoms are linked to psychological factors. So there's no physical cause, and the disorder kind of manifests itself as physical disorder. So you see this in how they are responding. So they feel physically ill, like their arms hurt, or they are feeling like they have a cold, or they're constantly sick. That's how the psychological disorder is manifesting itself to the person. So let's talk about the types. So there is a type called somatic symptom disorder, but there is also two subtypes called conversion disorder and illness anxiety disorder, formerly known as a hypochondriac. Now, before we get to the actual disorders, I do want to talk about the conversion and the illness. I do want to talk about two others. One is called the Munchausen Syndrome and Munchausen Syndrome by proxy, and then Gainsor Syndrome. So Munchausen Syndrome is where an individual will cause themselves harm to make themselves ill, to then get attention from a doctor or individual. So they might inject themselves with, in their veins with feces to make themselves physically ill. Now, Munchausen syndrome by proxy is where an individual, oftentimes we see this in mothers, will do something to their child to make them ill. In the movie Sixth Sense, the little girl under the bed, she's watching a video, and it's of her mother putting bleach in her soup, I think, and that made her ill, and that was getting the mother attention because she had this sick child. They had no idea what was making her ill, and it was her mother by poisoning her. So that is Munchausen syndrome by proxy, because you are making someone who's approximate to you ill. Gainsor syndrome is where an individual will fake or feign, or it's a false illness. They will pretend to be ill, either physically or mentally, to get attention, essentially. Yes, these are fictitious disorders. If you're willing to harm another individual, such as in Munchausen's syndrome, yourself or another individual, or in the Gainsor syndrome, does that not speak to having a disorder and there being dysfunctions and potentially being dangerous? Those are meeting at least 3 of the 4 Ds, if not the 4 Ds, and you, because it's unjustifiable. It's unjustifiable to make yourself sick or make someone else sick or to pretend to be sick. And it's very much deviant. That's not accepted into society, and it will be dysfunctional, and it's distressful. So yes, these are fake or feign, false disorders, but there's still some sort of mental illness happening within these individuals. Now let's talk about conversion disorder. This is also called functional neurological symptom disorder. This is where there's unexplained symptoms or deficits affecting voluntary, motor, or sensory function. In this case, we're talking movement of arms or legs. This is seeing or hearing. That suggests a medical condition, yet no medical condition exists. So whatever they're dealing with is manifesting itself in this physical way, and all of a sudden they go to a medical doctor to try to solve why they can't move their arm, or they can't feel their hand, or they have difficulty walking, or all of a sudden they can't see. Onset is usually after a stressful event, but again, they're at a medical doctor seeking help that is not looking at a stressful event. They're looking for a physical cause for this. Common symptoms either be movement or sensory are paralysis, but typically it's only going to be in like one leg, blindness, deafness in one ear, or difficulty walking. So this is motor movement. Many of these symptoms are anatomically impossible. So there's a thing called glove anesthesia where they can't feel their hand, but they can feel their arm. They can feel their arm all the way. There's nothing here cutting off their hand. That there should be nothing, because if they can feel can't feel their hand, but they can feel their arm, that's a clue that it's something else, because the sensations are in the spine. Okay, so if you have sensation in your arm, you should have getting sensation in your hand as well. One of the most significant indicators of conversion disorder is called Lebel Indifference. So kind of beautiful indifference is what this is referred to. The person has extreme anxiety in other areas of life, but lack concern about what appears to be incapacitating physical ailment. I can't feel my leg anymore. Oh, well, and they're super stressed about something else. But they're just not really concerned with the fact that they, might be deaf in an ear, or they can't move their leg anymore. Often such symptoms allow the individual to escape from current frustrating situations and sometimes lead to a secondary gain, such as attention or affection. Now let's talk about illness anxiety disorder. This is a preoccupation with the idea that one has or might get a serious disease along with misinterpretations of bodily symptoms or functions. They are very concerned that they're going to get cancer. And any symptom that they have, my arm kind of hurts, my bones are kind of achy, ooh, that might be bone cancer. Those are the things that we're talking about here. So 3 major characteristics. There's a physiological arousal. They're worried, they're anxious, often have sleep disturbances, so they're in turmoil a little bit, out of homeostasis, bodily focus, close monitoring of bodily features, and preoccupied with physical complaints. My ankle hurts today, my knee hurts today, it might be cancer, or I have a headache again, that might be a tumor. Behaviors designed to avoid or check for physical illness, avoids those who have a disease because they're afraid they might get it, and engages in repeated self-inspection or medical consultation. So they will go to the doctor for the littlest thing. I have a headache. I probably have cancer. I think I have cancer. I have a tumor. You got to check for a tumor. This is what these individuals do. Explanations. So for conversion disorder, this is conversion episodes are nearly always triggered by a stressful event or an emotional conflict. A big job interview that you really, really want, causing a lot of stress, can lead to a physical manifestation of that stress. You might see it with a football player or a basketball player. The big game's coming up, they've got a lot of stress, and all of a sudden they can't move certain body parts, or their vision has changed, and that's how their body is handling that stress. Easterners, meaning Eastern cultures, Asian cultures, African cultures, and women of all cultures are more vulnerable to this disease, mostly because socially it is unacceptable, especially in Eastern cultures, to go to the doctor, to go see somebody for mental health. But if it manifests itself as a physical condition and you can go to the medical doctor for it, that is much more accepting within their society. Illness anxiety disorders, although the causes are unclear, it's thought that personality, life experiences, upbringing, and inherited traits may all play a role in the development of illness anxiety disorder. That wraps up our 6th set of notes in the Unit 8 Clinical Psychology. If you have any questions, come see me. Otherwise, don't do anything too stupid. Bye, guys.